Hey everyone, welcome to qrsTV. Today I want to share with you an electrophysiologic concept. So not a specific rhythm diagnosis, but rather an ECG feature that can help us distinguish certain types of rhythms. So as we explore more rhythm diagnoses and try to figure those out, this concept can be really useful. And that is the concept of atrioventricular or AV association versus dissociation. So we'll start to explore this concept by using this normal ECG from a boxer dog. And what I want to show you first is AV association. That is in the setting of a normal sinus rhythm, which this ECG is. The atria and the ventricles have coordinated activity. And so how do we know that from our ECG? Well, that's because we have a P wave that precedes our QRS complex, and the relationship between the P and the QRS is constant. So we know the atrial activity resulted in the ventricular activity. That is AV association. Well, let's look at sort of another example of a rhythm. This is from a Cocker Spaniel. And the heart rate here is about 40 beats per minute, so it's quite slow. And what I want to point out are the waves representing P waves and the QRS complexes. And I think what we can appreciate here is that there are more P waves than QRS complexes. But furthermore, what I want to focus on is the relationship or the lack thereof between those P waves and QRS complexes. So I've put ovals around a few of these complexes. And if we look to the very far left, what you'll see is a P to QRS relationship that looks somewhat normal. But then if we move to the oval in about roughly the center of this ECG on the second line, you'll see that the P wave and the QRS are kind of crashing into each other. And then right above my head here on the first line, yet again, I have another oval around the QRS complex. And in this situation, the P wave is way out in front. And so what I'm demonstrating here is that the P to R relationship is changing quite a bit throughout this rhythm. And so my conclusion here is that we have AV dissociation, meaning the atria and the ventricles are not talking to each other. And that's really relevant when I'm trying to decide, what is the rhythm diagnosis here? And specifically, when we have more P waves than QRS complexes, I know I'm dealing with a form of AV block. And since I'm concluding that there is complete AV dissociation, I'm going to call this a third degree AV block. And in subsequent episodes, I think we'll come back to the concept of AV block in a few other ways. Well, let's take a look at this rhythm, again from a boxer. And here I have a very fast rhythm. The heart rate here is about 250 beats per minute. And what I want to point out here with my arrows is what I think are P waves popping in and out of this rhythm, sort of showing their little faces in between these wide, bizarre QRS complexes. And yet in other places, when I look sort of in front of the QRS complexes, I don't see those P wave deflections. So I'm showing that with my bold arrows. So here again, I'm thinking I see P waves kind of popping in and out, sometimes in front of the QRS randomly, other times I don't see them. So I think there is AV dissociation here. P waves and QRSs are not talking to each other, which again helps me sort of confirm that this rhythm, this fast rhythm, is probably coming from the ventricles. It's not being driven by the atria. So I would probably call this ventricular tachycardia. More on that later. Okay, lastly, this is an ECG from a Doberman pinscher. Really cool. Towards the right-hand side of the page, I have a heart rate that's about 100 beats per minute. Towards the left-hand side of this trace, so away from me, is at the beginning, maybe more like 190. But as I look at every QRS complex across this trace, whether it looks wide and bizarre like it does at the beginning, or more narrow and normal towards the latter half, there is a P wave in front of every single one of those QRS complexes at roughly the same distance. So here, regardless of what the QRS looks like and it's changing, I think there is AV association because I have a P wave, the same distance in front of all of my QRS complexes. So my conclusion here is that the atria are actually driving this rhythm, but then I have to come up with why the QRSs are changing. And that's a cool concept to come later. So hopefully this helps you with this idea of AV association versus dissociation. We're going to use this concept in upcoming episodes to figure out some more rhythm diagnoses. Thanks, and join me again next time.